Picture this, an unexpected medical emergency happens. You're rushed into the nearest emergency room. You don't understand most of the words the doctors and nurses are saying. You haven't eaten in 8 hours, you can't find your phone, all the alarms and beeping are stressing you out, and you don't know how to use your call bell. Then someone new walks in. They speak calmly and in plain language. They bring you a lunch tray and a blanket. They tell you how the call bell works, how to adjust the bed. They find your phone and even bring you a charger for it. They explain what the doctors were talking about and where you'll soon be transferred to. It's a patient advocate. The patient advocate helps in navigating the healthcare system, coordinating care, representing the patient, assisting with financial aspects, seeking needed services, and can be part of the treatment plan. This is the kind of work I witness as a volunteer helper for the patient advocacy staff in my local hospital. It's simple stuff, but it's human needs and connections that nurses often don't have the bandwidth to worry about. I saw patients' anxiety and stress leave them after a short conversation where genuine care and concern were shared. And I knew this is the kind of work I wanted to do, really helping people without all the blood and bodily fluids. So why do patients need an advocate? There are 5 main flaws in the US medical system that I'll explain first. Costs, lack of staff, the mental health crisis, struggles with medical jargon, including due to language barriers, and misdiagnoses. Of course, it's a very complex system with other issues, but we'll just focus on these 5 and how patient advocates can help. Number 1, costs. Medical expenses in the US are at an all-time high. According to the Peter G. Peterson Foundation, US healthcare spending reached $4.5 trillion in 2022. A 2022 poll found that 28% of US adults reported that they delayed or did not get healthcare due to cost. Number 2, lack of staff. In a recent study by Robert Half, 89% of healthcare managers are struggling to find new talent. According to a Kaiser Foundation and Washington Post poll, about 30% of healthcare workers have considered leaving their profession, with 60% reporting pandemic-related stress impacting their mental health. This stress, along with other pressures, has led to critical staffing shortages in hospitals across the country. The lack of staff often leads to nurses caring for too many patients. A nurse on Reddit shared, "As a nurse, we're taught to advocate for our patients, but I see too little these days. Not that nurses don't care, but they're rushed, overworked, understaffed, and burned out. Having another way to advocate for patients' wants and needs is long past due." Number 3, increased mental health care need. According to the World Health Organization, there's been a 13% increase in reported mental health disorders over the past 10 years. In 2021, the Substance Abuse and Mental Health Services Organization reported that over 33% of 18 to 25-year-olds had a mental illness in the last year. More people are seeking specific medical help that patient advocates can help them find. Number 4, struggles with medical jargon and language barriers. A 2008 study by the US Department of Health and Human Services found that only 12% of US adults are at a proficient health literacy level. The tasks they were asked to perform and 88% couldn't fully fulfill were important for real life, such as reading a set of instructions to determine what they could drink before a medical test or determining what time to take a medicine. Medical literacy tasks like this are even more difficult for someone whose first language isn't English. According to census data, 1 in 5 Americans speak a language other than English at home. While there are more virtual interpreter services available for these patients, they still come with drawbacks. One New York City medical resident said, "It takes 10 minutes of sitting on the phone to get an interpreter, and that's valuable time when you're inundated." The resident said, "So this utilitarian calculus kicks in, and the patients that are most mainstream get the best care." Patient advocates can help ensure that patients understand in their own language. Number 5, misdiagnoses. A study by BMJ Quality and Safety estimated 371,000 people die every year following a misdiagnosis, and 424,000 people are left permanently disabled. David Newman-Toker, a professor of neurology at Johns Hopkins Medical School, said his research estimates that being a woman or a person of color increases chances of misdiagnoses by 20 or 30%. Spending more time with the patient to document their symptoms can help catch some of these misdiagnoses. So we see that the need for a patient advocate very much exists. So how does someone become a patient advocate, and what training do they have to help you? There are no formal education requirements necessary for a career in patient advocacy, but there are a lot of degrees like social work, nursing, or healthcare management that can help get the relevant healthcare experience necessary for success in the role. Many patient advocates also have experience working as a nurse and can specialize in specific areas such as a cancer care patient advocate. While the degree requirements matter less, communication and problem-solving skills are vital for a patient advocate. They need a passion for helping people and the ability to do so effectively. Don't be afraid to ask for a patient advocate. Their job and what they love to do is help you. Patient advocates can work for insurance companies, hospitals, healthcare systems, the Patient Advocate Foundation, or other foundations, or they can be self-employed. The U.S. Centers for Medicare and Medicaid Services explains that it's pretty easy to find a patient advocate once you know they're out there. You can simply call your hospital and ask if they have any on staff. You can search online for a patient advocate or patient representative in your area, or you can reach out to the Patient Advocate Foundation. There are even VA patient advocacy programs to help veterans and their families who get care at VA healthcare facilities. A little warning, there are scammers who will try to pose as patient advocates to make money. Don't pay a person or a service that promises to keep medical bills off your credit report or to protect you from unexpected out-of-network medical costs. Next time you or a loved one is receiving medical care, remember that you can ask for a patient advocate to help you. They fight for you when you can't fight for yourself.